Thanks a lot for the opportunity to address you. First, I would like to congratulate the organizers for the hard work to make a Roma Health Network possible and to launch it during these difficult times. COVID-19 pandemic makes the life of our people very, very difficult, and it threatens their health as without water to wash their hands and without basic sanitary conditions, Romani people were first in the fire line. On the other hand, we could have seen public authorities imposing brutal lockdowns measures for our people in communities from Bulgaria, Slovakia, or Romania, instead of making sure they have access to what they need to stay safe from infection. Our communities are so of the most vulnerable, but not because they want to, but because many member states are neglecting their situation for so many years. We already know how bad the situation is. The data are telling it, and there is no need to mention them, because actually it is a reality, which is the strongest proof. For a couple of times I have visited a Romani community in Romania called Tinca. It's near the Hungarian border. And you see, for many people, especially for the Gage Sikh with anti-Gypsyism, it's easy to say Romani people do not like to go to school or work. They are wrong. Let me give you the example of Tinca. More than 60% of Romani children have hepatitis A. You know why? The garbage from the village is stored exactly at the entrance of this marginalized community. Children are being bitten by rats, are walking with bare feet, even during winter, do not have clothes to wear, they are not vaccinated, and they have absolutely no access to healthcare services. When I was there, I have invited a deputy director from the county health department, that was in Oradea, just a moment, health, yes, and in the begging, she thought she will not enter in the community because she was afraid of getting sick. However, I told her, this is your job. Who should help them if not you and the health mediator? You see, there are so many communities such Tinca in Europe. When people get sick, and when some are lucky to get some treatment, the illness comes back because it is impossible to cure when you are getting back in the same dangerous environment. No sanitation, no water, no canalization, a lot of garbage, no environmental and health justice. These people do not matter for the public authorities, but only if they are obliged by law to take care of them. By a specific targeted law, because we have mainstream legislation, but if how public authorities are legitimizing their work for Romani people, and I know cases. This is one of the reasons for which I have developed a resolution asking for a Romani law, and which was voted with a consistent majority of 545 votes in September. Now the Commission must come with the legislation text. The law will make sure that member states will develop measures to improve the health condition of our people and will allocate adequate funding for the implementation. This is a chance to reduce the life expectancy gap between Romani and non-Romani people, which is now even 15 years lower for our people, to reduce infant mortality, which is now 3 and even 4 times higher for our people than for the general population, and ensure a good start in life for our children, as the first 1,000 days are very important for healthy early childhood development. Combating health inequalities and promoting environmental justice are priorities of my work, and I assure you all of my support. Devleza, and thank you.